most frequent mistake that anyone does while recording the blood pressure of any patient is not explaining the procedure to that patient. So explaining the procedure to the patient is the most important step while recording the blood pressure reading, because of the fact that patient being anxious while recording the blood pressure can disrupt the readings, so that the procedure should be properly explained. Also, the other step should be also explained. For example, the legs should be uncrossed, as crossed legs increase the systolic pressure by 2 to 8 millimeter of mercury. Also, the bladder should be empty, as it puts pressure on the kidney, leading to a high blood pressure. And also, the patient should not talk, as it gives a faulty reading of 10 to 15 millimeters of mercury increased.